to maintain quality audio, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary Designee Andrea, and available to answer your questions are Dr. Ryan Westergaard, a Chief Medical Officer with the DHS Bureau of Communicable Disease, and Ryan Nilsestun, the Chief Legal Counsel for the Governor's Office. We will begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thank you for joining us. Today, I want to take a moment to thank you for help keeping your families, our neighbors, and our communities healthy and safe by staying home. Safer at Home is working, and while we're not just out of the clear yet, I am proud of the work each of you are doing and doing for yourself and for your part to help prevent the spread of COVID-19 in Wisconsin. Last week, we announced we would be extending our Safer at Home order, which will go into effect tomorrow, Friday, April 24th. According to a new poll released from the Associated Press and NORC, 61% of Americans feel the steps taken by government officials to protect folks from COVID-19 are about right. And the good news is that our Safer at Home order is much less restrictive than many other states across our country. Under our new order, you still can go out and take a walk, go for a bike ride, or walk the dogs. It's good exercise and it's good for everyone's mental health. But we are still asking you to limit your unnecessary trips, limit your travel to essential needs like going to the doctor, grabbing groceries, or getting medication. And although we're still encouraging folks to stay safer at home, our new order also includes some important changes and flexibilities. Starting tomorrow, our public libraries will be able to provide curbside pickup of books and other materials. Arts and crafts stores may offer expanded curbside pickup of materials necessary to make face masks and other personal protective equipment. And yes, starting tomorrow, golf courses may open up, which I know folks across our state have been asking for. You'll just need to schedule and pay for your tee time over the phone. As I've often said, getting back to normal won't be like a light switch. We have to think of it like turning down a dial. We're continuing to look at additional flexibilities to be able to turn the dial down before May 26th. And in the meantime, we'll all have to keep doing our part so that our families, our neighbors, and our communities are safe. In addition to all the folks who are staying safer at home, I also want to thank all the folks who have signed up to volunteer through our Wisconsin Emergency Assistance Volunteer Registry, or Weaver, to help support our healthcare workers and systems across our state. In the two weeks since we announced Weaver, more than 3,000 people have registered to volunteer. These folks will allow us to provide support to communities such as the 25 people who were recently referred to Racine County to help with local staffing needs. So thank you to all the folks who signed up to help. If you're interested in volunteering, we still need both clinical and non-clinical roles, from physicians to CNAs to social workers to respiratory therapists. You can get signed up today by visiting weavrwisconsin.org. Finally, I also want to thank some of our partners across our state who are helping make sure that we have enough personal protective equipment to be able to respond to the spread of COVID-19 in Wisconsin. Direct Supply is providing their expertise with our State Emergency Operations Center, providing logistics and warehouse support. ND Paper, which also has a plant in Wisconsin Rapids, generously donated 20,000 face masks and 1,500 isolation gowns. Foxconn has donated 100,000 medical masks for our COVID-19 response. Wisconsin's Kohler Corporation has provided 10,000 face shields and is using its supplier network to identify additional personal protective equipment donation opportunities. Thank you all for your good work in helping support our state during these difficult times. And Wisconsinites across our state who are continuing to stay safer at home, please keep up the good work so that we can turn the dial down as soon as we safely and responsibly can. And with that, I'll turn things over to DHS Secretary Designee Andrea.
Good afternoon, and thank you for joining us again. As the governor pointed out, Safer at Home is working, and we need to all continue working together to turn the dial to start opening up our state in phases. We are doubling down on the Badger Bounce Back plan to test every Wisconsin resident who needs a test, to trace every positive case and their contacts, and to track the spread of the virus. As we continue to make progress with more and more testing available, we are also working to increase our contact tracing capabilities. Contact tracing is a phrase that may be new to some of you, but as with many other things about this pandemic, is becoming more and more a part of our lexicon by the day. And as a fundamental tool, we need your partnership to effectively utilize in our efforts to contain the virus until there is a vaccine or other effective medical treatment. I'd like to take a moment to explain it a little more fully. When a COVID-19 test comes back positive, the local public health department is notified. At that point, a public health worker from that department calls the individual with the positive test result to interview them. During the interview, the public health worker will ask questions designed to identify other people who may be at risk of infection. Then, these at-risk people are notified of their exposure to COVID-19 so they can self-isolate to avoid spreading the virus any further. It's important to understand that no identifying information about the individual who tested positive is shared in these follow-up calls. The calls are critical notification and also provide information and tools for the at-risk person so they can take the necessary steps to stop the spread of the virus. As we build up our testing and contact tracing capacities and start to turn the dial, more Wisconsinites are going to receive calls from their local public health contact tracers. Just as you continue to be excellent partners in flattening the curve through Safer at Home, we will be asking you to answer that call and to engage in local contact tracing efforts to help us stop the spread of COVID-19. So now I want to give you an update on our numbers for today. Here's where we stand. We have 48 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 10,937 tests. We have 51,456 negative tests, which is an increase of 1,954 over yesterday. There are now 5,052 confirmed cases of COVID-19 in Wisconsin, an increase of 207. Our deaths now total 257. Thank you for continuing to do the important work of flattening the curve and for your partnership on Badger Bounce Back to help us get ready to turn the dial.
Thank you. We'll now open it up for questions. A reminder to maintain audio quality, to keep your phones on mute until it's time for your question. And in the interest of time, please, one question per reporter per media outlet. We'll begin today's questions with Mason Dowling from WAOW-TV in Wausau. Mason?
Yes, hi. Can you hear me?
Yes.
Perfect.
Yes.
Thank you for taking this call. This question is for Governor Evers. I understand that you signed an order to have a new testing site set up in the state fairgrounds earlier today. My question is this: a lot in our area, central Wisconsin, hospital systems are having to furlough and lay off workers because they're not seeing really any cases and they're just kind of in standby mode. How are we going to be helping the central Wisconsin or just across the areas not impacted in their hospital systems?
Yeah, so the governor and I did sign an order today for an alternate care facility on state fairgrounds, and I do think this is a place where Safer at Home and flattening the curve is really showing evidence, is part of where we're really seeing evidence that it's working, because to your point in your question, the capacity of hospitals has not been really tested or exceeded, but this alternative care facility will allow us to continue to turn the dial, to move forward, to be able to have the capacity that we need should we see a surge in the future. And as it relates to the capacity of systems more broadly across the state, I would say that one of the things we're very interested in making sure we are doing in partnership with hospitals who have the total discretion about how they do this, but some of this deferred care that is happening because we have been in a situation where we are trying to preserve all the capacity of our hospital systems for a surge in COVID-19 cases is building up this testing capacity, building up our PPE supplies, continuing to make sure that we are doing everything we can to ensure that frontline healthcare workers have the kind of PPE they need to serve patients in their systems. And those additional tools and capacities will really help bolster local hospital systems' comfort about starting to return to doing some of that deferred care, and that in turn will allow many of those folks to start going back to work in their healthcare systems. So it's part of the bigger picture for us. It's a piece that we are very interested in making happen as quickly as we can, recognizing that we continue to see PPE shortages here and around the country.
Thank you, Mason. Now to Monique Lopez from WLUK in Green Bay. Monique?
Yes, can you hear me?
Yes.
Great, thank you. This question is for Governor Evers. So the phase one of the Badger Bounce Back plan allows K through 12 schools to reopen, but only the gatherings that are still up to 10 or restricted to 10. Those just seem to be contradicting. They seem to contradict themselves, especially because most classes, even summer school classes, would have more kids. So how is that going to work?
Sure, I can answer that question for the governor. So in terms of phase one with the Badger Bounce Back order, it lays out areas that a new order would address. And like you said, it would have a 10-person mass gathering ban, and it would also allow K-12 schools to reopen. The thing to keep in mind is stated in that order, is that additional specificity will be provided to address some of the issues that you identified. What we wanted to do with the Badger Bounce Back plan was be able to provide some direction and guidance so the public knows where, once we meet these really critically important metrics in terms of having a downward trajectory on the number of people who are test positive for COVID-19, in terms of having sufficient hospital capacity and PPE, is that people know what to expect in phase one. But that will be delineated further to address, to make sure that schools can safely reopen, knowing that while they will reopen, it won't be how they were in December 2019, for example. There'll be measures in place while working with stakeholders, working with teachers, working with administrators to make sure that school can reopen, but it can be done so in a safe manner. And like most things in public education, there'll be a lot of local decision making that will need to occur.
Thank you, Monique. Now to WKOW-TV in Madison. WKOW. Okay, we'll move on then to Brendan Cullerton at CBS 58 in Milwaukee. Brendan?
Hey, can you hear me?
Yes.
Question for Governor Evers. With yesterday seeing such a sharp increase in cases, did that make you reconsider loosening these restrictions at all? And might those restrictions come back if we see more days like that?
Well, as you know, certainly you're always concerned when you see large numbers, but also keep in mind that the metrics we're using to move our system forward is per the number of tests. Now, I don't know how many tests were part of this 207, but clearly, if we use that, frankly, in the denominator of that fraction, the number of positive tests divided by the number of tests given, that will help us understand whether it's really an up or down. If, for example, if this is a stupid analogy, but if there's 20,000 tests given today and there was 13,000 tests given yesterday, and I have no idea, those numbers might be, tens of thousands off, but that could be the same percentage is what I'm saying. So the numbers in and of themselves, especially when they're coming from meatpacking companies that maybe aren't doing the best practices, physical distance practices. Hell yes, that's a concern. But as it relates to our metrics that we agreed to going forward, we have to keep in mind that that is divided by the number of tests given.
Thank you, Brendan. Now to Ben Meyer from WXPR.
Hi, this is with WKOW. I just got skipped because of some technical issues. Am I able to come in and do my quick question?
Go ahead.
Sorry about that. So, we have, after this protest is scheduled tomorrow, the request was denied, the application was denied, but they are still planning on going through with this protest. Does the governor have any response to the folks that are still planning on coming out to the Capitol lawn without a permit?
Certainly. I celebrate the First Amendment and celebrate people's ability to exercise it. Just keep safe distance apart.
Thank you. Now to Ben Meyer from WXPR Radio in Rhinelander. Ben?
Thank you. As you know, there are still 5 counties in the state that have not shown a positive COVID-19 test. They're all here in northern Wisconsin. Either for Secretary Palm or Dr. Westergaard, I don't know if he's there. Is it a good bet that all 5 of these counties probably have someone who's COVID positive and just hasn't tested positive yet or hasn't gotten a test?
So I'll start, and then Dr. Westergaard can dig in a little. So I think one of the things that's really important about how we're thinking about our expanded testing capacity and the work we need to do in this space is to make sure that it is more available across the entire state, so that we are getting a better handle on the prevalence of the disease in communities all around the state. And so whether it's our partnership with Exact Sciences or Marshfield or some of the other clinical labs around the state, we want to make sure that the rate at which we're testing in communities all around the state allows us to understand the prevalence of the disease, so that local communities have that sense, understand the kinds of things that we need to be doing together to protect the people who live in those communities as we start to turn the dial and move to a place where there's more active interaction among people. And so part of our strategy as we are expanding our testing capacity is to make sure that we are pushing that capacity into the parts of the state where they have not had as ready access to testing as other parts of the state. And I don't know, Dr. Westergaard, if you want to say?
Yeah. This is Ryan Westergaard. I'd say, of course, we can't say anything with certainty because we don't have the data from all the geographic areas. But what we've learned from other studies in other areas of the world and other areas of the country is that it's pretty common to have discovered after the fact that transmission had been occurring in the communities well before the first cases were detected. There was a recent modeling study from California, and there was also one from Washington State that said the date that we identified the first case through testing likely occurred after there had already been disease transmission in the community. And they know that by looking at a number of the genetic sequence of a number of other viruses that were diagnosed afterwards, and concluded that there had been sort of mixing and viral evolution over time. So we know that it's possible that the virus can be spreading silently before cases are detected. So that helps us really think about why the statewide strategy is necessary.
Thank you, Ben. Now to Will Cushman from WisContext. Will?
Hi there. My question is for Secretary Palm or Dr. Westergaard. It's a clarification question. I'm still a little confused about the parameter for in the Badger bounce back related to a downward trajectory in newly confirmed cases. Is that a downward trajectory? Is that like the proportion of positive cases to total tests conducted each day, or is it an ongoing total?
Sure. There's a lot of different kinds of parameters that you can use to determine whether an epidemic is growing, staying the same, or getting better. And so the plan looks at a few things from a few different sources, including syndromic surveillance and numbers of symptoms, with the specific piece about the percent positive case, or the proportion of positive cases, was something the governor was alluding to earlier. As a proportion of the number of positive cases, we want to see that as a proportion of the number of total cases, the number of positive cases is getting down. So there's two ways that would happen. One is that we're testing a lot more people and the incidence and prevalence are staying the same, or that the true number of new cases is going down. So right now our percent positive cases has been hovering between 10 to 12%. That's the number that we want to see gradually going down. So we want to see a day-by-day increase in that number, that percent positive over 2 weeks, before we feel like we're clearly going in the right direction. So that's the idea with that gating criteria.
Thank you, Will.
And that's the daily proportion.
Will, I'm
correct?
sorry, one question. We'll move on to Todd Richman from the Associated Press. Todd? Todd Richman?
Can you hear me?
Yes, we
Can
can.
you hear me?
Yep.
Yes.
This question is for the governor. How do you respond to all the people contacting your office with complaints about the extension? Some of them are pretty bitter, some of them are pretty desperate. How are you responding to them, if you are at all?
Of course, we respond to requests or to questions and comments. We also respond to the thousands of people that send us things saying this is something we're real comfortable with. Clearly, there are people in Wisconsin that are struggling because of this disease, and we believe that the best way to move this state forward is to attack the disease, attack the virus. While we're doing that, we're also looking for every flexibility we can find to dial back things that may be restricted businesses from opening or expanding. People need to realize that if you look at the number of essential services that exist in the state and that people are working in, is huge. It's much larger than most states in the nation. So we feel proud about that, and that's working. But there's no question, especially in the service sector, especially in small businesses, people are struggling. That's why we fought hard to make sure that people get the resources they need through workers' comp insurance, but also, unemployment insurance. But also we are doing whatever we can to make sure that we are in a place so that we can start to reopen different parts of our economy, and we will continue to do that during this time, up and through May 26th, if there's an opportunity to do something before. So yes, we also spend time, Todd, is working with our federal officials, finding resources for small business people so that they not only can begin to have the resources they need to survive, but also have the resources they need to create the supply chain they may need when they are going back into business. Of course, it's a significant drain on the entire country. We are not alone in that in Wisconsin, as you know, and we're doing everything we can to make sure that people are held whole if possible, and to have this disease be defeated or at least minimized as soon as possible, so that we can open up the state in a thoughtful and cautious way.
Thank you, Todd. Now to Hillary Kay from WWIB Radio in Chippewa Falls. Hillary?
Yes, this question is for the governor. Earlier this week, Assembly Speaker Robin Vos claimed that you have not had conversations with the legislator about decisions made during the pandemic since initial discussions about the election. Instead, they're claiming you've just unilaterally made decisions. So what do you say to that? And do you see the value of having discussions with the Republicans in regards to reopening the state?
Well, that's an interesting comment. I think our staff members talk to their staff members every single day. And I have on occasion talked to Speaker Voss about this issue, but the fact of the matter is I haven't seen the Republicans come to took them a month or 3 weeks, several weeks before they had their plan to bring to the legislature. So, I'm not going to involve myself in a back and forth on this. The bottom line is he and the legislative Republicans have decided to take this to the Supreme Court. And that's nothing more than a blanket, obvious power grab, which I reject. We hope that the state Supreme Court hears our arguments, which I think will be prevailing, and we can move forward. We're going to move forward. We're moving forward in the meantime anyway. So, going back and forth with Robin Voss at this point in time is not necessarily helpful. Our staff and his staff, if it's not every day, it's damn near every single day they talk.
Thank you, Hillary. Now to Steve Prestegard from the Platteville Journal. Steve? And a reminder, *6 to unmute your phone. Steve Prestegard from the Platteville Journal. Okay, we'll move on to Addie Bink from WFRV TV in Green Bay. Addie?
Hi, I was just wondering if maybe Secretary Powell, this would be for you, but if you would kind of explain how the state is involved in the outbreak that we're seeing up here in Brown County. Just wondering if DHS officials are up here trying to help out at all, if DHS would kind of make a final decision on whether facilities could close up here.
So we've been in very close contact with both the local public health department as well as the health systems involved in helping to do the testing that's going on among employees and family members of some of those work sites up there. We did not, as we have in other current situations, sent National Guard resources. What the request from the locals was to send some testing supplies, which we did. We sent over 2,000 test kits to Bellin to be used again to test workers, employees, and family members as they try to get a handle, as they try to get a sense of the size of that outbreak. So again, you can take that information and do the contact tracing that is necessary to get your arms around that outbreak and stop the spread. We also did facilitate a connection to the Centers for Disease Control, who do have a few resources on the ground to help with some of the data analytics, as well as some of the needed contact tracing. They're supplementing that local staff on those efforts, and so I think it's an important question in that it illustrates how we're thinking about our partnerships with local communities and where they've needed staffing resources, and we've been able to use National Guard units. We have done that where that has been what would be helpful to them. In this case, it was testing supplies, which we provided, et cetera. And so I think it speaks to the way we are thinking about being efficient with our resources, being good partners with our local communities, and wrapping around and supplementing the kinds of gaps that they may have in any particular situation, so that together we're doing what we need to do to protect communities all around the state.
Thank you, Addie. Now to Dylan Brogan from Isthmus. Dylan?
Hi, yes. I was hoping that you could talk more about contact tracers and how many have been hired. Are they working for local health departments or the state? And who's qualified to do this kind of work? And is there going to be a problem filling this ever-increasing position?
So we have put into circulation just about 150 contact tracers and have more in the pipeline. They have been provided some training by us to make sure that they are prepared to do the work that they need to do, and we have certainly modified that training over time as we have learned more about the complexities of the kinds of questions and interactions that these individual contact tracers are having with positive cases and with the context that they are notifying as potentially exposed to the virus. And we are currently actively working through our planning process around Badger Bounce Back to think about how to scale up this workforce in an efficient and high quality way, to your point, to make sure that the folks who are doing this work are doing it to the best of our ability to meet the needs of local communities. I don't know, Ryan, if you want to say.
Yeah, I'd elaborate just a bit that the activities to date have really been one of surge capacity for the purpose of making the phone calls that are necessary to track down these contacts. You know, in the next phase, when we really try to get back toward a position of containing individual cases and really trying to get to 100% successful contact in supporting people for isolation and quarantine, we think it's going to take a larger and a different kind of workforce. Hopefully that really leverages the community resources, so people who work in the communities have trust and rapport with the communities where cases are really in the best position to do that work. And the next phase of our building our contact tracing